we received a letter from a donor in Washington, D.C., and it was one of those letters that development people think, oh, someday it'd be great to get, but never thought you'd get it. And the letter stated who she was, and that she had been born and raised here in Cedar Rapids, and that she was very interested in donating money to St. Luke's Hospital if we had a major project. She did ask what the amount would be if she was to put her name on the facility. We were prepared for that question, and we told her, and she didn't blink an eyelash. And she said, well, I have several brothers, and it's very important to me that I honor and remember my brothers. And so would you be amenable to calling it the Nassif Heart Center in honor of one of my brothers? I said that would not be a problem. Helen was very, very successful as a business person. She was in banking, she got into real estate. Her husband was in old hotels. Helen knew she was intelligent, Helen knew she was good, and Helen knew she had potential. And Helen consequently went out and accomplished what she wanted to accomplish. And nothing was going to hold her back. It was about her career and what she wanted to accomplish. But knowing always in her heart of hearts that Cedar Rapids was where she was born, where her family was, where she was raised, and how much she wanted to give back to this community because it was important. It was her roots. It's where it all began for her. She was a true, I think, pioneer in her day for women. She was very, very proud of women that had, in her mind, had made an impact in society, had kind of picked themselves up by the bootstraps and gotten into the business world. She was incredible when it came to sharing her skills, sharing her knowledge, and sharing with other females what she felt was important, what she did, and what she accomplished to get where she was. When she said something of importance, everything was of importance, but really, when she would emphasize something, you knew she had given it a lot of thought, and what she was saying was important to her, and it meant a lot.
One of her dedications of one of the buildings that we had that she had named, she specifically said, the measure of one's life is not how long, how much, it is how good. And we are truly grateful and humbled by Helen's generosity over the years.
After we had built the Nassif Heart Center, the plan had always been in the background to then do a Center for Women's and Children's Health. And she was delighted with that facility, very proud of the fact of what went on.
One of the earliest trips I did was to go to Washington, D.C. to meet her for the first time. I mean, she had already helped us at that point with the Women and Children's facility, but we were in the early stages of trying to do some fundraising for the west entrance that she also ended up helping us with. She was very interested in not just the concept of it, but actually wanted to be into the numbers. She clearly thought like a business person. This was not just something she wanted to do, but it was clearly an investment for her. And so she wanted to know the details, and she wanted to know how it would work, and she wanted to know how her dollars would make a difference. And we did all that over an early lunch that was just also a lot of fun because she had a great sense of humor as well. And so really enjoyed my first meeting with her, and we were fortunate to have a number of those conversations over the years.
Many of the conversations that Helen and I had, not only about healthcare and what was going on in the hospital, was she asked me a lot about my family and my children, where they were at in their lives and everything. And the more comfortable I became in our conversations, I wanted to ask her about, her life, her background, and, what did she look like? And I used to joke with her, and up until the last, few months that I had visited with her, at that time I knew that I probably wasn't going to get to meet her. And, would she send me a photo? Could I see what she looked like today? Because my vision of Helen was, we have many portraits of her, was she was probably 30 years old, wearing a red suit and 6 feet tall. And I would always tell her this, and she would chuckle, and she'd say, "Oh, Mary," she goes, "no." She goes, "I'm probably only 5'3". Helen's donations over the years, and several years, were transformational to St. Luke's. Her leadership, vision, and faith in St. Luke's allowed us to take healthcare to that next level.
I mean, you can't hardly turn around in Cedar Rapids without seeing something that she's made a positive difference for. Clearly that's true here at UnityPoint Cedar Rapids, where she helped with the Women and Children's facilities, she helped with the West Entrance, she helped with the Radiation Center. Any major cause that we had where we thought we could actually make a difference in how we were delivering healthcare in this community, she stepped up every time. Those are the kind of things that stand out for me. Those are the kind of things that have made a difference, not just to UnityPoint or to St. Luke's, but also to our community. And she's just obviously saw this as part of her legacy, and it's something that we're very proud to be able to carry her legacy forward.
I would always reflect upon our conversations after we talked and really understanding the impact that a person can make when they decide to give back.
But she thought that giving back was an important part of who she was, and what anybody that had the means of any nature, any size, should look for those kinds of opportunities. Whether they have children or not, there's things that live beyond you. And she wanted to have that kind of an opportunity to make sure that the things that she did could help people well after she was gone. And that is exactly what's going to happen. The gifts that she gave to this organization are going to help this institution and this community for years to come. This is her home. This is what she wanted to build. She really felt very strongly about the Cedar Rapids community. And she wanted to make sure that everything that she could do as a philanthropist was dedicated to something in a big enough way to make a difference. And so she focused all those dollars and all that effort back here at home. She was a brilliant woman in so many different aspects, and so she clearly designed this that she would be able to give in many different ways during her lifetime, but well beyond that as well.